Hey everybody, my name's Travis. I'm an occupational therapist at Whitman Hospital. I'm here to talk to you guys about therapeutic ultrasound as a modality to use in your treatment. Therapeutic ultrasound is different than like imaging ultrasound for if you're like checking out if you are pregnant and looking at your baby. Therapeutic ultrasound is mainly used to heat up tissue, speed up cellular recovery, and increase elasticity. So one of the main things you have to do first if you're deciding on using therapeutic ultrasound is to really screen your patient, because there's some contraindications that you really need to be aware of. So they are, if your patient has past or present cancer, you don't want to use therapeutic ultrasound. If your patient's pregnant, if you're working around like a pacemaker site, if you have a young patient and they still are not fully developed, you don't want to go over any growth plates. If your patient has had a total joint, you don't want to go over any hardware because some studies have shown that the therapeutic ultrasound can loosen some of the cement in the hardware. So before you decide to incorporate therapeutic ultrasound in your practice, just kind of check what some other contraindications are before you choose to administer it. I mainly use therapeutic ultrasound to increase tissue heat for recovery purposes during and right before I provide stretch to the patient. I mainly am ultrasounding the arm or the hand. It has kind of been shown that therapeutic ultrasound doesn't do a very good job at going through muscle tissue or fat, so you kind of have to be specific on the part of the body that you're trying to heat up. So talking about the ultrasound itself, the first thing you want to do is figure out what sound head size that you want to use. If you're going to be working on a little larger area, use the bigger sound head. If it's a smaller, more focused area like a finger, use the smaller sound head. And then after you choose your sound head size, you want to choose what frequency you're going to use. So there's two frequencies to choose from. You got 1 megahertz, which is a little bit deeper. And then you got 3 megahertz, which is more superficial. So you need to decide, are you trying to penetrate deeper into the body, up to about 4 centimeters, or are you going more superficial, like over a tendon or a bone in the thumb? And then after that, you have duty cycle, which means, are you going to use a continuous ultrasound, which is more for the thermal effects. If you're trying to provide heat to the tissue, it sends a signal 100% of the time to try to do its best to get down deep into the tissue and heat it up. Or you have pulsed ultrasound, which you can mainly use if there's a lot of swelling or more of an acute injury and you're trying to pulse away some of that injury and edema and bring in some good tissue healing. So with pulsed ultrasound, there's 10%, 20%, or 50% duty cycle, which means like if you're on a 20%, it's only sending that signal 20% of the time and it's off 80% of the time. And then after you choose your duty cycle, you want to look at the intensity. So that is how quick and deep it is sending that sound wave into the body. So for example, when I use continuous ultrasound, and if I'm on 1 megahertz for that deeper tissue heating, I use anywhere from 1.5 to 2 watts per centimeter squared as my intensity. And if I am more superficial with that 3 megahertz, I use anywhere from 0.5 to 0.8 intensity. Both of those give good thermal effect and don't cause too much discomfort to the patient. After you choose that, then the last thing before you press start is just choosing your time. I usually ultrasound anywhere from 8 to 10 to 15 minutes, depending what area of the body I'm working on. Couple things about ultrasound and the technique when you are ultrasounding. You want to use a conducting gel. We just use a therapeutic ultrasound transmission gel. You want to put a pretty good amount onto either the sound head or the part of the body before you start moving the sound head around on the patient. Couple things to keep in mind is you don't want to go more than about 2 to 3 times the sound head size when you're ultrasounding. If you get in too big of an area, you're not really being effective at heating up the tissue. So you want to stay in a pretty localized area, and you want to be moving the sound head in a circular motion, keeping it moving. They say about 4 centimeters a second. So you want to be going a nice circular pattern, not going too big outside the area of the sound head. The strongest area of ultrasound waves comes out of the center of the head, and then it kind of gets a little bit lighter around the edges, kind of like a bell curve. So you're going to be strongest in the middle, a little bit lighter on the edges. So just keep that in mind as you're moving around, that not the entire head is equally pushing out those sound waves. It's mainly in the center and a little bit less around the edges. You definitely don't want to keep it in one spot. If you do that, you can essentially cause a burn to the patient, because those sound waves are entering the body and pretty much causing friction to the cells, and that's how the heat is increasing. And you want to be moving that around so it's not too localized and intense for the patient. Another thing to keep in mind is the tissue heat really only stays warm for about 3 to 5 minutes after ultrasound, and then it returns to a normal body heat. So I usually provide a stretch during ultrasound on the patient or immediately after, so that you actually are using that heat you've provided to the body, rather than trying to stretch someone multiple minutes after you've ultrasound. That tissue's already back to a normal body temperature, and you've kind of lost that thermal effect you're going for. The patient might say that they don't really feel the ultrasound happening, which is normal. Usually your skin sensory receptors are a little bit more superficial, and that sound wave is going a little bit deeper. So you don't want to keep cranking up the intensity for the patient to feel it. You want to set your parameters of what you feel is right for the patient and stick with it. The sound head will warm up, and so they might feel a little warm from the sound head, and they might feel warm from the gel if you've already had a preheated gel. If the patient is complaining of like a dull ache or uncomfortable feeling, you can reduce the intensity you're using to not cause discomfort to the patient. That's kind of a quick spiel about therapeutic ultrasound and when and how I use it in treatment. If you have any further questions, you can let Elise know, and I can do kind of a further question and answer after that. All right, thank you.